All right, topic Tuesday. This week is by Adam, our third-year medical student. And as he says, hello, beautiful people. You know, I just saw Funny Girl, so I've got a little bit of that Brooklyn thing going on. It's stuck with me. It's phenomenal musical,
Mhm.
digressing, but it was amazing. Anyway, all right, let's talk about something that we've touched upon already before for Topic Tuesday, and that is aortic valve disease. One of the things that kind of makes us different from other organizations is we don't just focus on thoracic aortic disease or strictly abdominal aortic disease or just aortic valve disease. We kind of got the whole thing. We start at the valve, and we focus on everything all the way down. So for this particular Tuesday, let's talk about aortic valve disease. There's a really good diagram in heart valve surgery that demonstrates the beautiful Mercedes-Benz structure of the valve, which you see right here. Okay. And the aortic valve is the last valve that blood will flow through before leaving the heart and going to the rest of the entire body. So it's underneath the highest degree of pressure. And you got to have three leaflets or cusps. This is a normal looking valve right here. And this is what it looks like when it's closed. And most of the diseases of the aortic valve happen because it's either too tight or too loose and floppy. And when this happens, the heart then needs to work extra hard to kind of do the valve's job because it'll start to weaken over time if you don't treat it. So this is what it looks like when it's closed, that Mercedes-Benz kind of symbol. This is what it looks like when it's opened. All right. Now, aortic stenosis, we've talked about this before. It can occur for any reason at any age. But when you have stenosis, it means typically that calcium or lipids or fats can develop around the leaflets of the valve. I am just like, I guess I need some candy because I'm looking at that candy for a while, and without it, I'm like having a stuttering issue right now. All right, so calcium or lipids can develop around the leaflets of the valve, and they can actually harden over time. That's stenosis, the hardening of that valve. And you can have stenosis of a vessel too, that you'll have these deposits and then they starts to harden. So as a result of having stenosis, the opening of the from the aorta to the rest of the body becomes a little too tight, causes the hard muscles to need to have to pump harder to do its job. And if you think about blood flowing through a hose, as you see here, okay, if you think about blood flowing through a hose, imagine what happens when you put your thumb over the nozzle, like depicted here, right? The pressure is greater and the flow is less smooth. I love garden hose analogies when it comes to aortic disease. There's so many different types of analogies, but this is a good one. So if you make it harder, like stenosis, by putting your thumb over a fully open valve that's now leading through the garden hose, you're going to make that spray less, but harder and less smooth. Okay, so that's kind of what happens with stenosis. Let's look at this puppy. See, adorable. All right, so common symptoms of aortic stenosis would be shortness of breath, tiredness, but shortness of breath is just not only for stenosis, so keep that in mind. But you could have shortness of breath, you could be fatigued, especially when walking or exercising. And some people with severe stenosis experience syncope or dizziness, could be a loss of consciousness, could be that you might pass out. And that's if blood is unable to travel effectively out of the aorta and feed the brain. All right. Now, stenosis usually occurs in older people, older, not sure how they're defining older. But one risk factor for aortic stenosis in younger patients, which would be 40 to 60, there you go. Okay, so I'm considered young. Hallelujah. It's good to be considered young. Would be a variant of the aortic valve called bicuspid valve. That's actually considered a congenital heart defect. A bicuspid valve is not contagious. It's not something that happens later in life. You are actually born with it. You just don't know that you have it till later in life, typically between 40 and 60, because you end up going for some other types of tests and it just shows you have this bicuspid valve, which means instead of having three leaflets, you end up having two. Okay, so you end up having two cusps. All right, so in bicuspid valves, and they're showing some stenosis right here. In bicuspid valves, there's only two leaflets, and that can cause them to harden earlier in life from calcium deposits, okay? There's a lot of research to suggest that bicuspid aortic valves could run in family. I know that there's research studies that have been going on regarding this as well. And what we're hearing is that it is going to be widely accepted that bicuspid valves are genetically involved. So be sure to get tested if somebody in your family has had a history of bicuspid valve. Just get an echo or scan, to see what kind of valve that you have. Well-documented histories of you and your family are always helpful when it comes to managing any kind of condition regarding the aorta with your healthcare team. Now let's talk about the other thing that happens with valves, and that's regurgitation. So this is a bicuspid valve. See, it's only got two sides to it. Didn't get the other little slice right in here, and this would be a tricuspid valve. But blood that flows through your heart should always be forward. It goes in one direction. Once the blood flows from one chamber or area to the next, it should never go backwards. Our valves actually seal tightly to help prevent backwards flow. Here we go. You find backwards flow sometimes when your pipes get stopped up, right? Sometimes water, instead of draining out of a sink or a toilet, starts bubbling up. That's a problem. That's regurgitating. Think of your tummy, okay? When some of us experience GERD, it's gastric esophageal reflux. It is regurgitating, it's coming back up, and it should be going back down. So aortic regurgitation refers to a floppy or leaky aortic valve. And when this happens, there's a little bit of blood that may flow back to the heart instead of out to the rest of the body through the aorta. And individuals with this condition may notice a lot of similar conditions to that of stenosis. So you could be short of breath, you could have weakness when you exercise, which is why I was mentioning, don't just assume if you have shortness of breath, you have stenosis or deposits or hardening. You could have regurgitation as well, or leaking. Some risk factors for aortic regurgitation include old age. All right, well, I have regurgitation and I was considered in the young age bracket. So we'll just also say it could happen to younger people too, right? Okay. If you have a connective tissue disorder like Marfan syndrome, or if you have a bicuspid valve, you are at risk to have regurgitation. So some things to just think about and to understand and to learn. And those are the most common issues you find with aortic valve disease. Now, bicuspid is one, much more common. Of course, you want to have tricuspid, but you also could have unicusp, and that's one. That's just like one cusp. This just seems so odd to me. Or you could have four. And I've asked radiologists before, like, how freaky is it when you find somebody with one or four? And they always say it is so freaky, like you call your colleagues and you have to look at this. Bicuspids are common. Anything less or greater than a tricuspid, they all like find it fascinating. So fascinating on us, the guinea pigs. But that is information about aortic valve disease. And we're going to learn a little bit more about treatment and all those different ways of treating bicuspids and surgeries, endovascular, open heart, the whole 9 yards on October 31st. So tomorrow we'll be discussing those next week. It's our Topic Tuesday.